Hey, beautiful people, welcome back to Unfiltered Fame. Today we break the silence around fibroids and take our power back one fact at a time. So, today we are diving into 7 common myths about fibroids that way too many people still believe till 2025. So, whether you're newly diagnosed, supporting someone, or just curious, let's bust some myths together. Let's go. First myth: fibroids only affect older women. This is a classic, yeah? People think fibroids only show up when someone is older, like 40, that is like post 40, but clearly we have some statistics from 2028 to 2021. Yeah, the truth is fibroids can appear as early as your 20s, even teens. In fact, many women are diagnosed in their late 20s or early 30s, yeah? It's not just an old woman issue, it's a reproductive age issue. Let's dive into our second myth. Yeah? If you have fibroids, you will always have symptoms. That's not true. About 30 to 50% of women with fibroids have no symptoms, yeah? We could have several fibroids and never know until like you do a routine scan until a scan like reveals them, right? So listen to your body, but remember, no symptoms does not mean no fibroids. That takes us to our third myth: fibroids are cancerous. This one causes a lot of fear, yeah? So let's clear it up. Fibroids are non-cancerous in 99% of cases. Fibroids are called leiomyomas. These are benign tumors where we have growth of muscle and connective tissue. So less than 1 in 1,000 may turn out to be cancerous, yeah? And that's extremely rare. So breathe. You can breathe. Having fibroids doesn't really mean you can have cancer, yeah? Takes us to our fourth myth. Yeah, birth control causes fibroids. This one is tricky. A lot of people assume birth control pills cause fibroids, but that's not backed up by science, yeah? The truth is, there is no solid evidence that birth control causes fibroids. In fact, in some cases, hormonal birth control can help control symptoms like heavy bleeding. So no, the pill doesn't give you fibroids, but it might help manage your symptoms, yeah? That takes us to our fifth myth. If you have fibroids, you can't get pregnant. Ouch. This one hurts, yeah? Because it's not true for everyone, yeah? While some fibroids, especially the large or the submucosal ones, can affect fertility, many women with fibroids get pregnant and carry health babies. We can see a health baby there growing amidst some fibroid, yeah? So do not let this myth rob you of your hope, right? Talk to your gynecologist to figure out what's possible for you. So also there is a myth like pregnancy doesn't affect fibroid symptoms. So during pregnancy, fibroids may grow due to hormonal changes causing pain and pressure. Those symptoms can also improve sometimes, yeah? Takes us to our second last myth. A hysterectomy is your only option. Absolutely not, yeah? A hysterectomy is one treatment option, right? But it's not the only option. if you don't know what a hysterectomy is, this is removal of the uterus. Yeah. So there are other alternatives, right? There is myomectomy, whereby we have the uterus, we have the fibroids removed. There is uterine fibroid embolization, medication or hormonal therapy, and even natural approaches for symptom relief, right? So every woman's body and goals are different. Your treatment should match your needs, right? If you want, for example, to have a baby in future, you can't opt for hysterectomy because you literally don't have your uterus, right? So yeah, I emphasize that your treatment should match your needs. That moves us to the last myth. All fibroids grow back no matter what. Here's the truth. Using our statistics, like you can see, they perform myomectomy pre-operation, myomectomy post-operation 1 year later, embolization before operation, and then embolization post. That is 1 year later. This is some of the statistics. What we need to know is that some fibroids can grow back, especially if you're younger and still have high estrogen levels, yeah? But not all do. And certain treatments can also reduce the risk of the regrowth, yeah? So do not panic. Talk to your doctor about long-term options, especially if you're trying to avoid surgery or manage future growth, yeah? Otherwise, I think we've come to the end of our myths, yeah? So if you're there and you've been having these myths, I hope we've been able to help and debunk them. What you need to know is that fibroids affect millions of women, especially Black women, and misinformation just adds that confusion and fear, which is why I decided to come up with this discussion. So if you've had other myths or you have questions, feel free to drop them in the comments. I'm here to talk about it. Don't forget to like, subscribe, and share the video with someone who needs it, yeah? Until next time, take care of your body, listen to it, keep owning your health. That's it from Unfiltered Fame. Bye!